Good afternoon to all of you. I am Irina and I'm the founder and CEO of Medi-Gyn Center, and center that originated from France and Monaco. And we are here in Dubai these days, as well as worldwide online. And we offer hormone health packages and programs, as well as consultations. We also offer services of regenerative medicine as well as functional medicine. We are very keen on doing a lot of educational work to educate you, to empower you, to make sure that you know what you are doing, to take ownership of your health. And today with me is our dear Dr. Henna, who is also a lifestyle doctor. She's a functional doctor, and we will be talking about the one and only, the Dutch test, and digging deeper to why we should do it and who should do it, and all the aspects of the Dutch test.
Sure.
So, Dr. Henna, good afternoon.
Good afternoon, Irina.
Very nice to have you, and thank you so much for coming and joining our podcast.
Thank you for inviting me.
Dr. Henna, so perhaps you would introduce yourself to our listeners and followers.
Sure. So I am Dr. Henna, a lifestyle medicine practitioner, functional medicine practitioner, longevity expert, in the sense that, and a medical director and founder of Vital Vibes Health and Wellness, where we ensure that we help individuals understand the root cause of their illnesses. And that's how we partnered with Medi-Gyn, because we want to help women understand their symptoms and understand the underlying conditions. So that's what we do.
And the great job that you underlined women, because we do and offer a lot of services, ladies, for your perimenopausal, premenopausal, but also peri and menopausal conditions, symptoms, which we as women tend to, as we've just talked about it, tend to normalize. And we tend to live with them rather than finding that root cause, and that's what functional medicine is all about.
Yes.
The root cause of every condition, which that is why we such great partners with Dr. Henna and Vital Vibes, because our goal is the same, to find that root cause of the condition.
Yes.
And to be able to help us with that, of course, we need to do diagnostics. We need to do a proper testing to understand what's going on in our body, and once we understand it, the how becomes much easier.
Yes.
So with that in mind, we are going to talk about the Dutch Plus test, or the Dutch test overall.
Yes.
So, Dr. Henna, tell me please, why do we need to do the Dutch test?
Now, Dutch test is one of the functional tests that is, offered in the market. Now, I always tell my patients, empower yourself, know your numbers. What happens is everybody does a routine blood test, and they have the numbers. But are those numbers the only thing that is required, especially when the numbers are normal and you still don't feel any relief? So that's where Dutch test comes into play, because Dutch test is a test which will give you an overall idea of the hormones. So if somebody who wants to know what is wrong with the hormones, adrenal hormones, sex hormones, Dutch test becomes one of the most ideal tests to do.
Well, with that, I have another question. A lot of patients of ours, and I'm sure patients who come to Vital Vibes, they may ask, well, I can do a blood test. Why not to do a blood test, and why do I need to do the Dutch test? Because at times, perhaps it's a little bit on a more expensive side. So what does really the Dutch test show us?
Okay, so in the Dutch test, now what happens if we compare the Dutch test to a blood test? Blood test, a nurse can collect it. It's a simple drawing of the blood at any time of the day, right? A Dutch test is a dried urine test for comprehensive hormone panel, right? And that is collected over a period of time at a comfort of your own house. Because the hormones, the working of a hormone, especially for women, is complex. The changes that her body feels over a period of time, or the changes of the hormones, are different compared to men. Comparatively. So in a blood test, you are getting the sample of only that particular time. It is telling you about the free hormones which are available in the body. Whereas in the Dutch test, not only we know the free hormones available, but we also understand which pathway, the physiology of the hormones, which metabolites are being released. Is it utilized the right way or not? Because body is complex. Dutch test gives you the physiology of the body, and that gives an even more insight to an individual's body. It's like a blueprint, or you know what is exactly happening, because there are times where the blood test result can be normal, but individuals are still suffering from complaint. They're like, okay, it is normal, but I don't feel good. Nothing has been helping me. What is wrong? So every time you want to know what is the answer and you've not been getting those, Dutch test could be the solution. And that's why, compared to the blood test alone, Dutch test gives you a detailed information, a deep insight on what exactly is happening.
Yes, very interesting. When would you suggest a lady or a gentleman as well? Because the Dutch test is also for the gentleman. But let's say we are on a topic of menopause, premenopause, menopause, perimenopause, menopause. And when would you suggest a lady should do the Dutch test? At the very beginning, or perhaps at the very beginning to just find out the level of her hormones? The blood test is enough, and then perhaps a second round or the third round of her hormone therapy, she could dig deeper a little bit to see what's actually happening while on a hormone therapy.
All right. So if I had to start on, the age categories of individuals who can do it, and if we let's stick to the female gender. Yes, males can do it if they are having stress or they've been suffering from decreased libido. Of course, even males can do it. But when it comes to the female, because of the diversity and the complexity of the way the hormonal changes happens in the body, it can be done at different age groups. Nowadays, we are seeing that polycystic ovaries syndrome is on a rise, right? And again, the regular treatment is going to be, okay, they see the estrogen or progesterone, those levels discrepancy, and they will start. But if still things are not being cured, then Dutch test can be done for even teenagers. It can be done in that kind of scenario with irregular menstrual cycles. We can do that. Then the most importantly, and I do recommend women doing it in the perimenopause stage, because doing it in a perimenopause stage, knowing what pathway, how are the what are the metabolites being created, how are the hormones utilized, becomes even good if you know it before you reach your menopause stage, right? So that's like a baseline. So irrespective you are getting the symptoms or you're not getting the symptoms, but you want to just take control of your health, you can do it. But even if you are having symptoms such as night sweats, brain fog, stress, fatigue, tiredness, unexplained tiredness, you can do these Dutch tests can be done even in your early 30s, late 30s. Then of course in the menopause stage you should be doing it. And it is also recommended, and something that I again encourage women to do, is if they are taking the hormones, the bioidentical hormones, even then you should do it, because that gives us an insight of how the hormone is being utilized, and then the dosage can be adjusted, and then you can even modify and complement it with the lifestyle factors such as the food or the sleep. You can kind of curate the whole program based on that individual. It's not like one size fits all approach.
Yes, absolutely. Very important to underline this point. It's no one size fits all, and at Medi-Gyn as well as at Vital Vibes we are so aligned on that, because we take a personalized approach, and I do believe that medicine is heading in this way, the whole industry is heading in this way, personalized approach, really looking at a specific person and their needs rather than prescribing something that is as if it fits all. Right?
Because unfortunately, there is a lot of noise in terms of information. There's surplus of information, which is confusing everybody.
Absolutely.
So We wouldn't say that all information circulated around is wrong or right. We cannot, because that is just information for educational purpose. Being able to identify what is working for you, that is crucial. And that's where the experts and these tests can help you.
Yes.
You know, this becomes very important because let's say many people during their perimenopause, menopause stage, they like to consume ashwagandha. That is one of the adaptogens. But it's not necessary that it will work for you. I mean, it can really help some individuals, but I also know many personally, it did not help them in any way.
Yes.
But you can supplement, you can give them or suggest another adaptogens which are not that famous, that you have ginseng.
Yes.
For example, nobody really talks about it. It's a Chinese herb. It's a good herb. And if taken in a right way, it can help. Then you have the holy basil, very common in India. Tulsi, that's what we call it. So that also helps. So you understand, you have to be able to identify what works for you rather than following a norm or what is the trend. Because your body doesn't know what is the trend, right? It's
Yes.
like what you have been feeding it, what are the environmental factors around you that you've been exposing your body to. Based on that, you should be making these changes or adding any lifestyle changes that will help nourish you, not following the trend.
Absolutely. Another point with the Dutch test is that we actually can see the whole path of cortisol, right?
Yes.
At different stages. Let's talk about this a little bit because it's very important. Nowadays, we live in a society of highly stressed society, let's say. And it's important for us to manage our stress well because stress then causes hormonal imbalances, causes chronic illnesses, and causes unfortunate conditions like cancer and so on and so forth. So tell us a little bit about the cortisol, how we measure cortisol with the Dutch test, and why it is actually so important to use Dutch test for cortisol measurement.
Now, in the good thing about the Dutch test, I mean, before I get into that, so what is cortisol? Cortisol is a hormone which is released by the adrenal glands. It is telling you how your body is responding to stress, okay? And there is a certain normal physiology that a body should follow. What is the normal physiology of cortisol? When you get up in the morning, it has to have high levels, and by the end of the day, it should go down in a systematic way, not just a drop down, but it moves in certain rhythm, and it has to come. This is just in putting it simply. Now, the Dutch test, what it does, for us, the cortisol, the window when we get up, till the 60 minutes, it's very important to see how our body is able to handle the stress. That is the best time and the best picture that you can understand how your adrenals are functioning, how your body is coping up. So in Dutch test, that's the first sample. That's the reason. Immediately when you wake up, within the 2-minute window, you're supposed to take one test. Then after 30 minutes, then 60 minutes. Because this time window, this time frame is very important for us. It tells you, and that is exactly why this test can identify. This is the reason we encourage and we tell our patients, please, when the day you decide to do your Dutch test, ensure that you don't miss out on the times and it is done accurately, because it depends. Your results and how we review it, it depends on that. So ensuring the time frame. This time frame is important because that is how the body is releasing it. Okay, so always you wake up within the 2 minutes window, you will take it, 30 minutes, 60 minutes. That window important. Why this is important and why it matters to us even when people are complaining about insomnia or sleep disturbances or stress. So we get a lot of patients coming with this issue and we do the Dutch test. So what did I tell you the normal was? The normal was the cortisol should rise in the morning and then it should gradually fall down. But in these people, we find out that the pattern is reversed. There is nothing happening. The body is not able to produce the cortisol in the morning. That's why they feel lethargic, tired. But in the night, there's a shoot up of the cortisol. Basically, their body clock, the body is not responding to the stress, or managing the stress or with the external factors properly. Why has this happened over a period of time? When we get to know, because they were not sleeping on time. They have messed up with their sleep cycles, the food that they're eating, the external factors, these were not taken care of. And of course, the additional hormones also play a role, the disbalance. And people who completely stop fat from the diet, these are fat hormones. They require fat. They require that to be produced. So you cannot eliminate fat. I mean, they get a bad name, but you need to consume good fats in your diet. So this is the reason. So extreme people who cut down, they also get these things. That's why then we start to reintroduce and we try to regulate. So that's why the cortisol, this test becomes very good, because it's also telling you about melatonin along with the cortisol. So it helps you regulate your sleep cycles. So this is why not only one parameter, it tells you different parameters, how it is broken down, which pathway it is taken, where should we focus on. This is essential. So
Yes.
so that's why the Dutch test gives you that insight, irrespectively. Okay, so I am not feeling, let's say, it's a common practice here. Okay, you're not getting sleep. Okay, I'll write you, prescribe you melatonin. That is a common practice here. But that might not help if the underlying reason for your sleep disturbances is the reversal pattern of the cortisol. It is not going to help you, right?
Absolutely.
So you have to understand the underlying cause. Yes.
So before we go into neurotransmitters, that I absolutely love the topic of neurotransmitters, and we will go into it, let's discuss a little bit another topic that I absolutely love, which is hormones.
Yes.
So we test quite a few of them, and we know exactly what is happening in each of them and with each of them. And we, more to the point, we know the hormone metabolites with this test. So tell us a little bit about that.
Okay, so because you earlier mentioned about the cancer, and that is the reason we are very concerned about the pathway estrogen and progesterone take. Now, for example, you've done your blood test and your levels have come normal. However, you are still having certain symptoms. It does not tell you initially or immediately, like as a prevention thing, that if you are at a risk of having breast cancer. However, when you take this, because it is measuring the pathway, the metabolites that are being created, we see the estrogen, which is free, but we also see the metabolites. In the sense, when I say that, if we see a predominance of certain metabolites like 16-OH, different estrogen that is formed compared to the 2-OH, the other form of estrogen, if we see 16-OH high, 2-OH low, okay, we can say, okay, you need to be careful because you're having estrogen dominance, and that is a risk factor for cancer. So let's say if you are taking externally, we would ask you to reduce it. Or if you are not taking it, we will put you on pregnenolone to help you, because usually with these levels, we see low levels of progesterone. So we will introduce that so that it helps you with the other, moderate your symptoms. But this is why the pathway becomes important, to decide whether you need it or you don't need it, or to regulate it, or to help if you're taking it. Like, I'll give you an example. So we had one patient already on the bioidentical hormone. I mean, whatever symptoms that she was suffering from, hot flushes and mood swings and not getting sleep, it had reduced but not completely. And that was like, okay, you know what, we are giving, then what is wrong? So, okay, let us see how her estrogen is broken down in her body. So the breaking down of the pathway is where we found this discrepancy. So, okay, the way her body is breaking it down is not right. So we reduce the dose, and then we tell them to add certain food elements like cruciferous vegetables to the diet, so that the pathway that the body takes is the right pathway, not the cancer pathway, not the releasing the carcinoma. We don't want that, right? We want to regulate the pathway. So we support it with the right kind of diet and sleep, then it takes. And then over a period of time when we do it, okay, so that has improved. You see, this is why, I mean, we are in times and age where we can take control of our health. You can be in the driver's seat to be like, okay, what is happening? I want to know right now, and let me just take charge of it. And you can do that. It's not like before that where you're just getting these reports and then you just have to listen to whatever the physician says, okay, this is it, and you do it. But no, now you have an opportunity to be like, no doc, tell me if I can know what exactly is causing it. So take charge of that. I mean, the moment you do this, it becomes very easy for you. Then you know if it is working for you, it's not working for you. Absolutely. Right? Without anybody just giving you a superficial answer, oh, maybe it is. But now you can know, no, this is working, this is not working. This is taking, so you have the breaking down of the pathway is the right pathway. So doctor, why is my body not breaking the estrogen the right way? Why am I not seeing good levels of progesterone in my body? Okay, so we do this. Oh, the reason it is taking the other pathway. It is going through a pathway, but it is not releasing the right things. Then we ask you, what is your lifestyle like? What is your food intake like? You're not doing this, but we need to support the body. We need to improve your liver detoxification so it supports your body. So then we regulate it. So no matter what you do externally, you might be taking a lot of things externally, doing a lot of things, you're doing red light, you're taking all these supplements, but if the breakdown in your body is not happening the right way, it is not going to help you, right? So that's why this helps.
No, absolutely. With hormones, we know from our patients day in, day out, that it's so important to supplement also. We highly promote a great lifestyle. Whatever the lifestyle we have, look at various aspects of your lifestyle and improve. Whether it's nutrition, whether it's exercise regime, whether it's supplementation. And when you are on bioidentical hormones, whether you are for a long time or for a short period of time, it's always good to supplement, and it's always good to add on certain things that will help you to assimilate, to absorb hormones and so on and so forth. So the Dutch test will really show you that absorption, that metabolic function of your hormones, right?
Yes, metabolic function is very important, and because many are living a very sedentary lifestyle, they're not, so these pathways are getting affected. And a lot of intake in terms of heavy metals, microplastics in our body, these things cause disruptions. This is not a normal thing for the body, and your body, your liver, your kidneys are trying to remove, liver being the major detoxification organ, is trying to eliminate as much as it can. But because every body reacts differently and sometimes it doesn't get the right kind of support, then people start seeing the symptoms, wondering what is happening to them, So this is why you have to be very careful with the ingestion and whatever, even the products. Because the good thing about also doing, when we do this, we can tell you to check the products that you're using, are they having any endocrine disruptors? That is also identified in this, because many young girls, teenagers in their early 20s, we see PCOD and all of that. Then when we see the report and we see then we ask, okay, what are the products you're using? Most commonly we do find it in the the makeup products that they're using, or the candles, the scented candles that they are used to smelling. So those are all endocrine disruptors. So we can identify that as well.
Very good point, because there are so many of them, and sometimes we don't even realize. Even our lotion, body lotion, it's endocrine disruptor. Our perfume, endocrine disruptor. To the greater or lesser degree, it could be. So on that point, let's move on to neurotransmitters, because Dutch test is the most comprehensive test, and it shows us, of course, neurotransmitters as well as how hormones work, as well as nutrients. But let's touch on neurotransmitters at the moment.
Okay. Similarly, like how we touched upon the hormones, like the estrogen, progesterone, cortisol, even neurotransmitters play a huge role in that. And whether they're eliminated in the right way, are they metabolized in the right way? So the people who are suffering from lack of focus, brain fog, inattention, these things also get identified, because we understand in the pathway, okay, something is there, antioxidants are not being produced, there is some mishap that is happening. So how do we complement it? Like I said, it is because these pathways are complex, so it's not always one thing. It is always the other thing. Like even over here for the neurotransmitters, when we see the discrepancy, it could be because of the irregular levels of estrogen and progesterone, which is causing these imbalances. So it's always the underlying thing. So the DHEA that we see for the adrenals and the neurotransmitters, antioxidants, it's always the underlying pathway, the underlying cause that is causing the disruption in the neurotransmitters. And because these neurotransmitters are very, very important for us into our day-to-day functions, we are seeing that young adults are losing their cognitive function. They get blanked out, phased out, they don't know what is happening, they are not able to regulate formula, they are losing their creativity, and the thinking, logical thinking is disrupted without realizing, okay, what am I putting in my body? What is happening that is making me do this? So yes, so again, this test helps us identify the we can tell you how your health is, your brain health is also based on the neurotransmitters, and then understand what has caused it, what is the underlying cause for these, discrepancies, and then target those areas to treat you.
Yes. Interesting, you mentioned melatonin
Yes.
At the very beginning
Yes,
of our
melatonin.
conversation. Extremely important for your hormone health, extremely important for your longevity, extremely important for looking good, for
Yes.
feeling good.
Yes.
So what can Dutch test tell us about melatonin and how we can improve on it?
Melatonin pathway is also shown in the Dutch test. Okay, so again, all the things that you mentioned, the main function of melatonin is sleep. There was a reason why it's called I need to get my beauty sleep. Right?
true.
If you are sleeping on time and you have mastered the art of regulating your sleep cycle, you are just 80% of your health will be in balance. A person who is in bed 9:30, 10 o'clock has the most perfect circadian rhythm. Melatonin is releasing in the right time because our body's clock is designed in a way when there is sunrise, we want to be ready. We want to be able to start doing the work. So the cortisol has to be high. But when it is time to go to bed, you don't want to fight a war at that time. You want to relax. And once you're doing this 9 to 10 o'clock, that period is very important because all the regeneration and all the restoration happens. That is your body's healing time.
1 second, I thought the restoration and regeneration happens between 1 a.m. and 3 a.m.
So it is that time is also important,
Okay.
but growth hormone releases. So it is a cycle. It is done in a cyclic way. So it happens in a different time frame. So, but you have to be in the bed. So you get into the REM sleep mode, and then you are, you're more relaxed because, you get paralyzed in your sleep. So you're basically, your brain has to fall asleep and you don't have to get up first. So usually if you get up first and your brain is, then there's sleep paralysis, you're not able to move, right? So you don't want it, but so that there's a reason, there's a whole cycle that is happening. So the ideal time is 9:30, 10 o'clock, you should be there. So that growth hormone releases, then again restoration, everything happens. For children, again, it is important earlier that as you grow older, you can do all your work in the morning. If people identify and understand the power, like if you are sleeping right, you have let your body healed and restored. And in the morning, if you are waking up like before sunrise, that time, if people understood the power that you have at that moment, they would not be the night person, they would be morning person, because that time in the morning, you are in control. That is the only time in the 24 hours you are in control, if you think about it. Because that's the time, whatever thought you put, whatever manifestation you do, it will happen. Because the moment you are out of your house, you're in a work, you are in a reactive mode. You're not in a control mode. You're just reacting to the situations around you. So yes, that time, and the reason you want to create that routine for yourself, your hormones will be in balance. Melatonin also, that's why melatonin is important. You want to regulate melatonin at its right time, cortisol at its right time. So if you have that regulation, morning and the sleep routine, two of the most important routine that you have to take care of. Like Ask any successful person what they do, they will tell you it's our morning 15 minutes, morning 20 minutes. Like I manifest it and they are able to achieve it, because that is the power, because your body is in full control and your brain cells, your body listens to your thoughts.
Yes.
It becomes what you eat, okay, and it reflects what you see and you hear. So it's not just one aspect, and you set the tone in the morning.
Yes.
If you are able to set that tone in the morning, you've won half the battle. I mean, your day would go good.
Yes.
Nothing around you would matter. But yes, take that power in the morning, I would say.
Yes, absolutely. So on the subject of hormones, let's go a little bit back and touch upon estrogens, because there are quite a few of them.
Yeah.
Can we see all our estrogens in the Dutch test?
Yes, majority of, because you're going to see all the breakdowns. So, so it's unlike the blood test, you're going to see everything, how it is metabolized, even the breakdown of different types of estrogen, free, binded, anything, everything you are going to get. All the metabolites you're going to see. So, a 1, 4, 3, you're going to get all those 16 OH. We want to see all those estrogens. So yes, you're going to see different, because everybody thinks estrogen is just one. No,
yes.
But body is much more complex than that. If you would have seen, a network room where everything is with the wires, you will understand how complex. So imagine it's our body. So there is a very complex environment. So yes, so there are different breakdowns. So you get to see that on the Dutch test. And not only estrogen as a whole, but also their byproducts. The metabolites are important because each one has a function.
Yes.
So you want to see each one, you want to see which one is dominant, which one is not dominant, what is not being produced, what is being produced. If it is being produced, is it being produced in excess? Is it going down the right pathway, or is it taking the wrong pathway? Is it going through a carcinogenic pathway?
Yes.
Or it is going through the pathway which will help us, maintain our beauty and everything. So you have to, it gives you that overall idea. So that is the reason this became a very revolutionary test when this came across, right? Because I mean, just when we compare it to just getting, okay, estrogen, progesterone, that ratio, okay, that's it. But when we got to see, oh wow, we are seeing the entire pathway. Yes. Like for me as a practitioner from the medical background, okay, I understand the physiology and I'm able to, read the test and tell you. But yeah, so it could be a little complex when just somebody else, they're like, okay, what is that? We see all the circles and arrows, what's happening? But no, but it gives you a very detailed insight.
Yes.
Yes.
Mention a little bit estradiol, which is the most potent, the most vital hormone, one of the estrogens, hormones, for ladies.
Yes.
Especially at any reproductive stage.
Yes.
But of course, perimenopause, menopause, we see the drop in estradiol.
Yes.
And because of that drop, because of that fluctuation during perimenopause, especially when estrogen fluctuates a lot, we see various symptoms such as brain fogs, such as memory loss, such as fogginess, brain fogs, I said. So tell me please, how can we naturally assist our estradiol to be boosted kind of, and to have it at a higher level? Is there a way?
See, when it comes to estradiol, lifestyle factors play a huge role, right? And body, the way for a woman body, every age, the level of the hormone are meant to change, right? Because now perimenopause, the level is going to be different compared to the, when she's in her menopause stage. So it goes down. What are we trying to do here? We want to maintain those levels because the body is depleting those levels. But if you want to do lifestyle factors, lifestyle modification, then it is, you have to have the right amount of protein in your diet. This is important. And a balanced meal becomes very important. Healthy fats, have your avocados, have your eggs. These things are really important to improve your estradiol. Have fiber, omega-3, these things, vitamin D. all this is important. You want to limit your caffeine, you want to limit your alcohol, you don't want to get into the smoking. So these things will again disrupt. So yes, naturally you need again doing muscle building exercise, but not become bulky, but something that will help improve your muscle function. Those are the exercises. Sleeping on time again. So everything matters. Practicing meditation, grounding, these things will help regulate estradiol.
Yes.
Now, what happens is sometimes along with this, you can give your body an additional support, and that is where the bioidentical hormone comes in. And we can regulate exactly how much to give your body again with the test. So you let's say that even if we start you or you want to get started, so as a precautionary measure, we want to see how your body is already utilizing these hormones.
Absolutely.
Right? So once we have that picture, and then we do these add-ons. And with the pathways, we tell you, we add on the hormone, and then we supplement it with either supplements, whatever, we feel, omega-3, the vitamin B12s. These are B complexes are very important. So we give you those, and then also mention what food that you need to intake, when, how you need to intake. Like again, adaptogens, I do not tell people to take that during the night because you don't want to get stimulated. You want to take it during the day because you want to feel boosted. So the time, how to take it, how to consume it, and then when you complement it with the bioidentical hormones, then you don't feel those symptoms. It's all about creating an environment for your body by giving all these right nourishing and superpowers from externally to help your internal environment.
Yes.
Yes, so if you have those levels, you add it, it becomes very easy.
Yes, absolutely. And here I would like to encourage you ladies to not letting your symptoms take over your life.
Yes.
And not start not normalizing them. Start looking for solutions which are available these days. In the sense of the Dutch test, you can check exactly what levels you have. You can check exactly where you are at with hormones, as well as with bioidentical, but then your lifestyle and what you do in your daily life matters a lot, right?
It does, because it's quite sad, and it worries me when I meet patients who are like, yeah, doctor, I've always been getting these cramps. Yeah, but that's a normal. Oh, I always feel constipated. That is not normal. You were not born with a development defect. There's not a defect in you. You're not supposed to be feeling pain or having brain fog. That is not normal. I mean, yes, our lives have become too stressful, but let's not normalize these things. You are what is normal? What is when you wake up in the morning, you're feeling refreshed, you feel motivated. That is normal.
Rested,
not getting waking up in the morning and being like, oh, I don't want to go, I'm having headache, my eyes are watery. That is abnormal. So do not normalize things which you yourself know are making you feel bad. Right? And now we are at times where science has advanced to an extent that even I, as a doctor, whenever I have to use a phrase idiopathic, there's idiopathic means cause unknown. I feel like seriously, we should not be using these terms anymore, because we have availability of test, availability of technology, even at a epigenetic level, to tell us what exactly is wrong. Yes. So if we are sitting and still saying, oh, we don't know the root cause, okay, let's just try to treat you, like let's hit the target in the dark. No, we don't want to do that. Yes. Right? You want to be like, what? No, what is wrong? You have to take charge. It is just one life. This is one body. This is your true treasure. True luxury is always your health. Yes. And the moment you take care of it, you will see that everything else follows. And take advantage of the advancement in science. I think that is, and now there are so many evidence available, so many research papers and articles available. You can see that and make decisions for yourself. Yes. Like you can ask your physician, okay, could you tell us, doctor, what are the studies that are done? How can I benefit from this? And we can definitely do that. And again, remember, it is not one size fits all approach. Please understand that. It is more that you take all this and see what is working for you.
Yes.
And you are able to do that. You've been given that superpower now.
Yes, absolutely. So on that positive note, your temple, take care of your temple. Your body is your temple.
Yes.
Take care of your temple and you will live happily ever after. And of course, to take care of your temple, bear in mind the diagnostic tools are available. You can purchase them on Medi-Gyn.com. If you have any information, please do send us an email, info@Medi-Gyn.com, and we will connect you with our doctors, with Dr. Henna Kuti also, who will be able to read your blood test or your Dutch test analysis very well, and we will know where exactly you are, right?
Yes, yes, absolutely. I think anybody who is willing and wants to take charge of their health and well-being, I think this is the way to go.
Yes.
Yes.
Thank you so much, Dr. Henna, for joining us
Thank you,
today.
Irina, for doing this.
It was wonderful to speak to you and to actually share this vital information with you, our patients, viewers, followers. Thank you so much.
Thank you. Take care.
We are done. How did we do?
How did we do?
50 minutes. That's good. Super flowing.
Were we good with the flow? Were we good? Yes, because since you were listening to us. So.
It was very smooth.